of the genomic alterations are prevalent in this particular population type. And we will not talk about the pathology, why this is happening, but these are the data. I'm done? Half an hour done? My goodness, I have not even started showing my data. Okay. So this is what, are you sure 30 minutes from my time I started, you're talking? How much? 10 minutes. Okay, quickly we will convey some of the messages. But what is interesting about the liquid biopsy, this had changed the paradigm. Big revolution in the cancer. The liquid biopsy and biopsy, make it very simple. Biopsy, anything you take it surgically. So it's called biopsy. You do tissue biopsy. So the patient has to go through the surgical process. And many times it's very difficult to ask patient to give the multiple biopsy sample. However, liquid biopsy is something which is non-invasive or minimal invasive. Because even I'll put an injection, somebody may not like it. So we call it minimal invasive. But what you get, that any such biofluid, it could be saliva, it could be urine, it could be blood sample, it could be tear sample. But if such biofluid will give you similar kind of information, what you would eventually get it from the tissue biopsy, that is the impact of liquid biopsy. And this is what you could see, circulating tumor cells, the cells which are getting disseminated from the primary tumor. The cells disseminate intravasate, extravasate and reaching to the distant organ and involved in metastasis. So this is CTC, circulating microRNA, exosome, ctDNA. So these are the different kind of liquid biopsy markers which we eventually use in the clinic. And one such beautiful example, each of you should remember, this is ctDNA, which is called circulating tumor DNA. So what actually, it actually, the clinical perspective, now we are using routinely ctDNA. So every patient sample, when we get tumor biopsy or FFP sample, we ask many times that can you give us the matched blood sample? Or many times when I told you that patient may not able to give the biopsy sample, the clinician rely on the blood sample. Because what you will get the ctDNA. Now see how it makes sense. Much before when you do the imaging, because generally in cancer, you go for CT scan, PET scan. So much before imaging, you could see the asymptomatic patient. Then you would see that you could actually monitor using the ctDNA. Just ctDNA concentration in the blood or mutation on the ctDNA. But you could actually do the surveillance, which is called MRD, minimal residual disease. So when patient has been treated, we call the patient after 3 months, 6 months, 1 year follow-up. And what you do, you ask just the blood sample, you look this blood sample, you look for ctDNA, you identify the mutation, and many of those mutations you would actually see that some of the mutations evolved, which you may not found earlier from the tissue biopsy, you would get it from the ctDNA. And those patients are treated because we identify such mutation with the ctDNA. So this is an amazing tool which is routinely used now worldwide as the ASCO guideline and ESMO guidelines we follow. I will just show one such a study. I think I had a beautiful study to share, but it is not going to happen now. But this is what we published in Journal of Clinical Oncology. This is with Tata Medical Hospital. Me and Kumar Pravar put an amazing effort where we have done the genome profiling of lung adenocarcinoma. And what you would see that there are some mutations. What you would see EGFR mutation, which you could see that the frequency of mutation is 45%. Imagine. And what you compare with the TCGA, which is 12.4%. See the disparity of a mutation, one such example. But what you see that 88% of Indian lung adenocarcinoma patients at least one activating alteration. So if any patient present in the clinic with lung adenocarcinoma, you may definitely identify at least 88% of the patient where you will target a mutation. There is a drug which could target a mutation. Okay, I will just skip. These are much more detail about the correlation.